The aging population is the fastest growing segment of society in many countries, and life expectancy is increasing. As we age, we want to continue to lead healthy, active, and independent lives. Yet, aging naturally takes a toll on our bodies, and virtually everyone experiences a decline in function as we age, especially of joint comfort and mobility. In fact, poor joint health affects over 30 million people in the U.S. alone. Lasting mobility also underlies the ability to perform the activities of daily living and remain independent as we age. I'm Jeremy Appleton, and as a naturopathic doctor and R&D professional in the nutrition industry, it has been my goal to develop scientifically validated ingredients that can help people achieve their health goals. Once we enter our 40s and 50s, supporting joint health becomes important, whether there is discomfort or not. The wear and tear that has occurred over decades inevitably leads to some degradation of the joint tissues. Symptoms from this are often not experienced until the later stages, so it is advantageous to begin supporting joints early, before we feel discomfort, in a proactive and preventative manner. There are no magic bullets for reversing decreased joint function, but there are certainly supplements that are available that can help support mobility and the integrity of joint cartilage as we age. Which products is the question? Products often come with extravagant claims that are not supported by science. But a few, like MSM, have been studied under controlled clinical conditions and have been shown to work. What is MSM? MSM stands for methyl sulfonyl-methane, also known as dimethylsulfone. It is a sulfur-containing nutrient and a methyl donor. Sulfur is an important and abundant mineral in the human body, and it is particularly important in connective tissues, such as hair, skin, nails, and joint cartilage. MSM has been studied in vitro, in animals, and, most importantly, in clinical trials in humans. Preclinical research has demonstrated several mechanisms of action for this unique ingredient, such as anti-inflammatory activity, antioxidant, and has shown that it is a building block of connective tissue. OptiMSM is an ultra-pure, premium-quality MSM that is backed by both preclinical and clinical studies for safety and efficacy. This research, published in peer-reviewed medical journals, has shown that OptiMSM supports healthy joints and connective tissue, improves joint function and mobility, reduces joint stiffness and discomfort, protects the cartilage, and supports the body's natural inflammation response. The most compelling evidence of OptiMSM's support of joint health comes from 3 independent, randomized, double-blind, placebo-controlled clinical trials. All 3 studies looked at a very common problem of osteoarthritis of the knee. And all 3 demonstrated that MSM, when taken for as little as 12 weeks, may improve measures of joint function in osteoarthritis of the knee. In the first study, by Usha and Naidu, 118 adults with mild to moderate arthritis of the knee were given either 1.5 grams per day of MSM, of glucosamine, of a combination of the two, or placebo for 12 weeks. Both MSM and glucosamine, as well as their combination, significantly improved the signs and symptoms of osteoarthritis when compared with placebo. MSM alone and the combination treatment also significantly decreased the mean pain index. At the study's conclusion, swelling was also decreased by MSM, glucosamine, and their combination. There was a statistically significant decrease in the Lacane index, a validated scale for evaluating the efficacy of osteoarthritis treatments, and all treatments were well tolerated. A second clinical trial, published in the eminent journal Osteoarthritis and Cartilage, corroborated and expanded upon the findings of Usha and Naidu. In this study, Linda Kim and colleagues looked at 40 adults with osteoarthritis of the knee, and these adults were given 3 grams twice daily of OptiMSM, or a placebo, for 12 weeks. Compared with the placebo, MSM produced significant decreases in pain and physical function impairment scores on the WOMAC scale, another validated assessment for osteoarthritis. Ability to perform activities of daily living was also improved by OPTI-MSM as compared with placebo. In a third randomized, double-blind, placebo-controlled clinical trial, Pagonis and colleagues treated 100 subjects with osteoarthritis of the hip or knee using 3 grams twice daily of MSM for 26 weeks. Compared to placebo, the treatment group experienced significant decreases in all subscales of the WOMAC pain and physical function indexes, as well as improved performance of activities of daily living. The decline in pain and the increase in physical function continued at the 26-week mark, suggesting that the benefits of MSM would continue beyond the time frame of the study. OPTI-MSM is a safe, effective, science-supported ingredient for joint health. The clinical trials on OPTI-MSM confirm what many doctors have known for well over a decade, that MSM by itself and in combination with other supplements such as glucosamine is a safe and efficacious option for supporting joint health and is free of the side effects of non-steroidal anti-inflammatory drugs and acetaminophen, often used to treat the condition. When joint health is maintained, the body can continue to perform the basic activities of daily living, and this helps ensure greater independence and quality of life as we age.